What's up, guys? I'm here doing some ACL return to running testing today with Anthony. Anthony is a pro soccer player in the UK who had a surgery here and is staying with us for his rehab until he goes back. Let's get started. So one thing that we really want to establish with an ACL post-op is as little asymmetry as possible between legs on as many variables that are pertinent to a sport. We're going to start with single leg jump testing. We're looking for sub 10% difference between legs. Okay, so you're gonna go on your non-surgery leg first, left leg. All I'm gonna instruct you to do is hands on your hips. You're gonna bend your knee a bit and then jump as high as you can without tucking the knee in. Okay, so single leg, triple jump, crossover, timed. We did a vertical and we're gonna do a 10 hop test. You're gonna start with your foot on the zero. You're gonna jump on a single leg. I don't really care about the landing as much, but try your best to land, okay? Good. That's 81. Good. Beautiful, 74. So we use a battery of hop tests to assess side-to-side differences in an athlete's surgical versus non-surgical leg. And this gives us an insight as to how well the athlete can produce force, how well they can absorb force, and basically their readiness to progress into sprinting and accelerating and how safe it is for us to do so. Non-surgical triple jump, okay? And don't think about landing the last one. As you land, other foot comes down and I measure the leg, okay? Let's go. Pop, pop, beautiful. Good. 2, 1, go. And turn and back. Good. 560, take 30 seconds off. So what I want you to do is you're gonna hop 10 times on a single leg. It's gonna measure how long you spend on the ground and how high you jump. So you have to try and find a good mix of both, okay? It's gonna give me a value called an RSI, which tells me how well your tendons work and how explosive and bouncy you are, okay? But you can see we're looking for 15% or less to pass, okay? This one isn't bad. I'd like to see this number a little bit higher, but because you're such a good athlete, you're still the 96th percentile for your age, your gender, and your weight. So that's an excellent test. We're gonna keep going with this every time you come in until you're at 15. So keep with the rebound plyos until this gets a little bit more efficient. Okay, but great test. All right, so that's the importance of objective testing and why it's so important for an athlete to clear criteria before we clear him to get back to whether it's sprinting or jumping or cutting. And so this is an example of an excellent test. And so now today, because of these metrics, because of his strength metrics, because of the limb symmetry, we know that it's safe to progress him into sprinting and changing direction, which is where we're going to start going today.